Welcome, everyone, back to another episode of the Parkinson's Policy Podcast, where we advocate together and raise awareness and advance meaningful policy for the Parkinson's community. From Washington, D.C., straight from the Capitol and beyond, we bring together senators, representatives, researchers, advocates, and so many other individuals making such an important impact today in society, as well as amplify the voices of people living with Parkinson's disease. My name is Dr. George Ackerman, founder of TogetherForSharon, joined by my co-host, Margaret, Preston, president of Power Over Parkinson's, and we want to welcome everyone back to another episode.
Thank you so much, George. I have the honor to introduce our next guest. Ann Hubbard was appointed Chief Public Policy Officer of the American Parkinson Disease Association, also known as the APDA, in August of 25, to create and lead APDA's Department of Public Policy and Advocacy, developing strategy in the critical arena and building APDA's presence at both the federal and state levels across the country. And collaborates closely with other leading PD organizations to maximize our collective impact for the Parkinson's community. And brings a wealth of experience in strategic leadership in health policy and advocacy through stakeholder engagement, along with a strong record of effectively working directly with members of Congress and various federal regulatory agencies. And joins the APDA after serving as a successful leader at the American Society for Radiation Oncology, or ASTRO, as their Director of Health Policy for 11 years, where she led efforts to inform Medicare and private payer of policies that impact the practice of radiation oncology. Prior to that, she held senior roles at the Maryland Hospital Association and the Maryland Department of Health, among others, consistently driving meaningful change through her strong leadership and policy expertise. Ann has a BA in government and politics from the University of Maryland at College Park and an MBA with a concentration in finance from Loyola University, Maryland. Ann, we can't thank you so much for being our next guest on the Parkinson's Policy Podcast.
Well, Margaret and George, it's a pleasure to be with you all. Thank you so much for the invitation. I'm glad we're getting a chance to do this.
I wanted to start off before we get into the policy, first saying how, as you likely know, we met in DC, but the APDA has a special place in my heart. When my mother was battling Parkinson's in South Florida, APDA literally showed up, and even though it was kind of, late in her stages, it was something that resonates and sticks with me 24/7 beyond, and really drives me to continue to want to advocate for others. So I want to thank you and the entire organization always for such incredible support.
Well, thanks for mentioning that, George. APDA is an organization that is very much community-based, grassroots, and we're here to show up for people living with Parkinson's disease and their families. We have, as you probably know, education and referral centers across the country, but also state chapters that provide resources and referral information for people living with Parkinson's. Our goal is to improve the lives of those living with Parkinson's and those who care for them as well.
Thank you for that. And as we start this journey together today, was there something that impacted you to want to encourage you to go into the world of advocacy, specifically policy, especially since this is something I'm surprised as an attorney that it's fairly new, but really at the forefront of advocacy today?
So I'm glad you asked. Yeah, my connection with Parkinson's really began just before COVID. My father was diagnosed with Parkinson's disease. And, like many families, I think we were all a bit surprised. Dad had always been a super active person. His schedule was always busier than mine. It was hard to keep up with him some days, but we noticed that he had started shuffling. And after a couple of doctor's visits and then ultimately a DAT scan that confirmed it, we learned he had Parkinson's. And so not only were we adjusting to, kind of a new schedule with the medication and the need to maintain his activity, we were also going into COVID. And so that was a real struggle for our family. On the other side of COVID, I'm happy to report that Dad's doing great. He continues to engage with the Parkinson's community through his local Rock City boxing. He's an active square dancer. But, until Dad got his diagnosis, it was not really a disease that was on my radar. And the more I learned about it, the more I realized that it had been, significantly underfunded by NIH, and there was a real advocacy need around Parkinson's disease. And so when the opportunity came up to join the team at APDA, I threw my hat in the ring, and I can't tell you how happy I've been since I've joined APDA, almost now 10 months.
Wow.
Thanks. We send our love to you and the whole family, and want to send the show to Margaret to start us off.
Yeah. And your story and your dad's story sound a lot like my dad in terms of being very active, got a Parkinson's diagnosis and continues to be very active and keep going. So cheers to that.
Exactly. Cheers to that.
Absolutely.
Just gotta keep plugging away.
Well, I would be remiss not to kick off our conversation without noting the recent announcement from Syngenta that they were going to cease production of paraquat. I think it's important to discuss this, what it means from an advocacy standpoint, and can we take a collective sigh of relief, or is the work still in front of us?
It's a good question, Margaret. I will say that when I saw the announcement, I thought, wow, this is a pretty incredible step for an company like Syngenta to make this announcement. But the work isn't over. Just because the company is going to stop production doesn't mean that sales of paraquat are going to come to a standstill. It doesn't mean that there won't be other companies out there producing and selling paraquat. Paraquat is a generic chemical, and so it will continue to be utilized. And really, until it's banned, that's really not quite ready to take a deep breath and a sigh of relief. And so that's why one of the key things that we're working with our friends at the Fox Foundation and the Parkinson's Foundation on is state-by-state wide bans on the use of paraquat. And it's, of course, something we're continuing to keep an eye on at the federal level as well. EPA Administrator Lee Zeldin tweeted in January that the EPA was going to revisit paraquat. And we're hopeful that that will enable the community to have more opportunities to engage with the EPA on the impact that paraquat has on Parkinson's patients. And, again, that process will take some time, but, these are good steps in the right direction, but certainly not the end of the fight to ban paraquat.
Thank you for sharing that. If I can add, we are so incredibly thankful for the work being done at the state level, and with various states having legislation right now. I had the opportunity to testify against our own bill, 1375. Again, it was tabled until 2027, but the work was still meaningful and fruitful, and that we were able to educate lawmakers and set the groundwork for hopefully a productive session next year as well.
Exactly. I think there'll be a lot of groundwork setting this year.
Yeah.
In hopes that we can make some real advances next year as far as legislation is concerned.
Definitely.
Well, one area that I'm still today shocked in a happy way, but also shockingly way, is that only a few years ago was something called the National Plan to End Parkinson's Disease passed. And again, as an educator and historian of my own, learning every day from people I meet, to have just the first, federal legislation unanimously passed, but only happened a few years ago. My mother, unfortunately, never was able to see that. I think she would have been really happy to see that, finally our voices are being heard. But, why do you feel just a year or two now, advocacy has become such a focus in the forefront, especially, just past March when we all convened together? And I never will forget, even though it's been 2 times, being in the Capitol. It's almost like you're in a movie, and it's a happy movie, but we want a happy ending to this story too.
No, that's right. We all want a happy ending. To your point, George, the National Parkinson's Plan legislation that was passed in 2024 really kind of got things kicked off. And that plan included the establishment of an advisory council at NIH, which, we're still waiting for that advisory council to be seated. We're hopeful that we'll hear something from the Department of Health and Human Services before the end of April regarding the seating of that council. And the work associated with that council will be critical as far as determining, the appropriate amount of research investment that NIH should make in Parkinson's disease research, as well as evaluating and prioritizing those things that the federal government through NIH, as well as other agencies, can do to improve the lives of people living with Parkinson's disease. And so that's one key piece of advocacy that we're really focused on, is making sure that that council gets seated, but also making sure that those deliverables are meaningful and result in actionable activities that can be pursued in the coming years.
Thank you.
The other key component around advocacy that has really gained some momentum is around existing NIH funding and the fact that it has been virtually flat for the last 5 or 6 years. And, the concern there, of course, is that without additional research funding, there, are limited opportunities to secure advances in disease management, but as well as ultimately funding a cure. And so one of our key goals is to secure additional NIH funding up to $600 million by 2028. And we know that there's a lot of pressure at the federal level, to reduce spending. The last year, the president introduced his budget with a 40% cut to NIH. Tomorrow, we're expecting the 2027 budget from the president, which we are hearing rumors there'll be another cut to NIH of around 20%. And so advocating and pushing back on those cuts, but also advocating for additional funding dollars for Parkinson's disease research will be critical moving forward. And so the other side of that, of course, is the work that's happening at the state level with regard to research funding. I think a lot of states are recognizing that the federal government is constrained in its ability to fund additional research. And so states are taking this on. And the Texas initiative that secured $3 billion in neurological disorders research last year was just kind of one initial effort to do that. And we're hopeful to see other states follow in their footprint.
I'll never forget the feeling asking Senator Rick Scott in Florida for the amount of money that we are in the, definitely fascinating to be at that table and part of history. So thanks for all the efforts you're doing.
Sure.
And I think before we jump into our next question, hopefully we'll see we'll see a little bit more of a snowball effect, right? As states do these types of things and allocate these funds and potentially ban paraquat, and seeing the state level snowball effect ideally.
I agree. I'm hopeful that, other states will take a look at what's been done in Virginia around, pursuing a paraquat ban, even though that's kind of a foundational thing, and think, oh, we could do this too. Similar to the Texas initiative, which was successful. That's one that other states can easily replicate.
Definitely. Well, as we march through 2026, what would you say are really the pillars from the APDA policy strategy? What would you say kind of you guys are focusing on as we continue down 2026?
Sure. So, now that the Parkinson's Policy Forum is behind us, that was in March, here we are in April. It's Parkinson's Disease Awareness Month. And, we're going to continue to focus on those advocacy priorities that we highlighted during the forum. That's the $600 million NIH investment in Parkinson's research, seating the National Parkinson's Policy Council, as well as banning paraquat. Other activities that APDA is very focused on are activities around supporting caregivers, caregiver tax credits that may be, under consideration at the state level, but also at the federal level as well. We have aligned ourselves with the team at AARP and are very supportive of the work that they're pursuing around caregiver tax credits. Okay. We're also very focused on coverage to biomarkers testing. This is something that we're collaborating with the American Cancer Society, Cancer Action Network, and other groups to ensure those coverage policies at the state level include biomarkers testing. So those are some of the key issues that we'll be focused on in the coming months. And then again, as part of Parkinson's Disease Awareness Month and the National Parkinson's Day programming on April the 7th, we'll be pushing out more information for individuals to continue their advocacy, because sharing the individual story is so important. And that's what really drives lawmakers to think about, okay, this is a priority for my community and it's going to become a priority for me too.
Thank you.
Yeah.
One area I really enjoy is being there, live with other advocates, also people, not that they want to be, because it's just, we don't choose the path, but we are in a great and beautiful, inspiring community once we are together. We just had the Optimism Walk in Palm Beach, so it's again, I think it's now my 7th or 8th, which is scary because it's you turn around and remember when my mother was actually still with us. So I feel, a memory lives on through the work of APDA and everyone, Power Over Parkinson's and Together for Sharon. The one thing that stands out at those events is community. How can our community and all communities throughout the country join with the APDA and support some of the work you're doing, and specifically in policy?
So it's a great question, George. And supporting the advocacy work really starts with reaching out to your member of Congress or your local elected official, and that's something that APDA can help with. One of the things I'd like to encourage people living with Parkinson's disease to do is invite an elected official to a Rock City boxing class, invite them to a Parkinson's disease support group meeting. These are opportunities for elected officials to not only meet with the community, but learn about Parkinson's disease and really understand how it impacts those living in their community. Tip O'Neill once said that all politics is local. And so I think, it's such a good point that bringing everything to the local community is really where elected officials understand what is top of mind for their constituents and recognize where there are opportunities for them to act on those top of mind issues.
Thank you. As we continue talking about how to energize folks around the nation, care partners, patients, etc., what are some ways we can energize patients, care partners, in the community at large to really get involved in policy effort?
So definitely have them reach out to APDA, and we have a APDA advocacy team that we're pulling together across the country. Many of them will be based at the state level, and so we want to make sure that we have an opportunity to engage with advocates who are interested in reaching out to their state elected officials or federal officials. We can help them do that. We can help them identify those opportunities where there might be a way to invite an official to an event in the community, whether it's a APDA Optimism Walk or, like I mentioned, a support group or Rock City boxing program. The other thing that I wanted to highlight, we've talked a lot about community, is APDA has just recently produced a public service announcement. I don't know if you all saw it. It went live yesterday with the kickoff of the Parkinson's Disease Awareness Month. And that PSA, just sending that to an elected official and saying, hey, this is something that I live with, and sharing that PSA with them can be really helpful. And as we've discussed earlier, it sets the foundation for educating people about what Parkinson's is and what it means for someone who's living with the disease every day. And that PSA can be found on the on the APDA website at www.apdaparkinson.org/PSA.
Thank you.
Well, one thing that I thought as I was in DC 2 times, hopefully it'll be back again in the future, was that the work didn't really just start there. It's when we got home is when the real work began. And as Margaret and I can tell everyone listening, a lot of this is behind the scenes that they don't, people don't see, and it's 24/7. And I just hope that the work continues even after this show concludes. It doesn't end till there's a cure. And just so grateful, for your time, the entire APDA. We send our love and thanks for always supporting Power Over Parkinson's and Together for Sharon over the years. But as we wrap up, we always like to know what message of encouragement can you leave the Parkinson's community today in the terms of public policy?
So in terms of public policy, the message of encouragement, every story matters. Every story is a opportunity to move the needle on NIH research, move the needle on getting the advisory council seated, move the needle on banning paraquat. It starts with your stories. I never will forget the opportunity I had to work early in my career with a patient advocacy organization. And one of the best patient advocates said, our data, the data around the numbers, the number of people who have Parkinson's, the 82 billion in economic burden, the numbers make us very credible, but the stories make us memorable. Yeah. So share your story, because that's what's going to make Parkinson's memorable to elected officials. And that's what's going to make them, act on those asks that we have of them.
That's so well said. Thank you for sharing that.
Thank you.
I wanted to thank you for your time. Again, the APDA, I wanted to send this shirt out, Margaret, for any closing comments.
Yeah, and we just wanted to thank you for sharing your time, your expertise, your passion, personally motivated as George and I are. I can't thank you enough for kind of leading the charge nationally along with some of the other organizations across the nation to guide us and allow us all at the ground level to have the tools we need to advocate, like you said, share our stories and move the needle. So thank you so much for being with us.
Oh, it was my pleasure. It was great to see you all, and hopefully we'll see one another in person soon.
Yeah, we would love that.
I want to thank both of you, of course, all the work that Power Over Parkinson's, especially Adam and the entire organization, and of course APDA and Ann. It's an honor to have said I met you twice now, and hope for many more times to come, and such inspiring work and really bringing important change, not just in Florida, Virginia, but countrywide. I also want to thank everyone listening. This has been another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. From Washington, D.C., literally from the Capitol and beyond, we bring together senators, representatives, researchers, and advocates to amplify the voices of people living with Parkinson's and their families, because again, as we wrap up today, everyone, no one's alone. We'll be out there fighting right by your side. We thank you. We love you, and we'll see you soon. Thanks, everyone.